This is Dr. Paul Lieber. I'm here today from Regenexx Pittsburgh, and I am going to talk about regenerative orthopedic medicine. So let's get started. At the end, I'll answer all your questions. Hopefully, I'll provide you with some information which will be helpful. Regenexx is the trusted alternative orthopedic surgery. So I want to proceed now, and hopefully you can see this. This is a scene from Pretty Woman, Julia Roberts, Richard Gere. Which So everybody has dreams. I think it's important when you're in this situation to have dreams. Can you hear? Hopefully you can hear me now. So I had a dream back in 2018 where I was interested in riding my bicycle up the Alps in Switzerland and Italy. And my dream was interrupted in May of 2018 when I tore my tibialis tendon, ruptured when I stepped on an object that was sharp. I had had tendonitis with riding my bicycle and training, and ruptured my tendon. And that was temporarily the end of my dream. So I went to see a surgeon. He said, you should have a tendon transfer, cut off my heel, performing a calcaneosteotomy, resecting my gastroc above the Achilles tendon, that I would be 3 months non-weight bearing. It would take me at least a full year to recover. There was a 22% complication rate, and I would be in an Arizona brace for the rest of my life if I didn't undergo surgery. Well, that wasn't to be the case. I had some stem cells in my ankle. I had some stem cells in my left knee, and I did rehab. I didn't need a brace, and I did have custom orthotics, but it felt very good to have avoided surgery. So in July of 2022, 5 years later, I was able to fulfill my dream and ride my bicycle up the Alps. So who is this webinar for? Why are you here? And what are your dreams? I think it's important to know that lots of people can be helped by regenerative orthopedic medicine, and that you don't have to be an athlete necessarily. There are things that everybody wants to do, but your pain and injury get in the way of your being able to fulfill your dreams. So you've been in pain, you've been told you have to live with it, you want to avoid surgery, you don't want to have artificial body parts, you don't want to be bionic. You don't have time for lengthy downtime in rehab. You want to stop taking medications. You know people who have failed surgery before, or perhaps you've failed surgery yourself. Um, you may have medical contraindication surgery, or you're even too young for surgery. A little bit about me. I'm board certified in physical medicine and rehabilitation. I have subspecialty in pain medicine and interventional orthopedics. I've been practicing for over 30 years. And this is really what keeps me going. I'm a cyclist and love to ride my bike. And I have had regenerative procedures in the past that have enabled me to uh, keep on top of this and enjoy myself. In Pittsburgh, I've been voted best doctor 4 times. So I have a lot of experience with this, and it makes a big difference. Our practice, we have 3 doctors, Dr. Adelsheimer to my left, Dr. Sally to my right, 2 locations, Pittsburgh and McMurray. We're all board certified in physical medicine and rehabilitation, and we have this subspecialty in interventional orthopedics. Dr. Sally holds the board certification in sports medicine. Dr. Adelsheimer and I hold board certification in pain medicine. So we treat lots of areas from the top of the spine to the big toe in the foot, musculoskeletal conditions, shoulders, elbows, wrists, ankles, hips, knees, etc. Some specialty treatment that we provide, we can repair anterior cruciate ligaments that have been torn. We can repair rotator cuff tears, labral tears, meniscal tears, and also we can treat dead bone. So there's a condition called avascular necrosis we'll get to later, but we treat this as well. I wanted to talk a little bit tonight about spine. This is the area that really came in late in the practice about 2016. We started in 2012. But it's great for people who have irritated nerve roots, for sciatica, painful or herniated lumbar or cervical discs, facet joint pain, which is pain in the back when you arch backwards, ligament muscle pain, spinal stenosis, the older people who are hunched forward and can't walk well, and post-laminectomy syndrome. We treat people who have surgery, fusions above and below the level of the fusion with good success. And about 80% of the people with spinal conditions do well with regenerative treatment. The majority of the treatment that we provide is through platelet-rich plasma, which is in your blood. We extract the PRP and treat you for the painful nerve roots on the left upper side, painful facet joints, painful ligaments on the left lower, and even ligamentum flavum, which is a ligament that surrounds your spinal canal and interferes with your ability to function when you have spinal stenosis. So by treating that ligament, we give your spinal canal more space. We treat fascia, we treat inside the disc. So what is PRP and how does it work? Well, it has growth factors and other things that amplify healing. It's in your bloodstream. We concentrate it. It works like an espresso shot for local repair of tissue, and it treats in conjunction with stem cells to make them work harder and longer. It's a standalone as well. So for collapsed discs, we use platelets and stem cells focusing on ligaments, joints, nerve, and muscles. We can treat herniated lumbar discs with 4th generation platelet lysate. Platelet lysate is your platelets that have been frozen, ruptured, filtered, and it's pure immediate release growth factor. We can treat painful or torn discs with PRP or same-day stem cells injected into the disc, and the same is true with bulging discs. And this is just an example of putting PRP, or a bone marrow concentrate, read stem cells there, into a torn disc to heal the disc from the inside out. And it works very well. So intradiscal stem cell results, best if you look on the right-hand side where you see those white spots, which represent leaking discs. And we heal the outer layer of the disc, and 6 months later, those disc tears are repaired. We also treat neck pain, upper back pain, mid-back pain, headaches, and have good success with that. Again, 98% of spinal treatment is with platelet-rich plasma. That's all you need. So what is Regenexx? Regenexx is a very highly selective physician network. There are about 150 physicians in the network system-wide. We use proprietary high-dose stem cell and platelet-rich plasma protocols. We are the world's leader in research and development, and we have a nationally self-funded employer practice. Excuse me for stepping away. We also have a nationally self-funded employer program. We have about 2,000 self-insured employers providing this to their employees now for free or reduced cost, depending upon what the who the employer is. And this is within the specialty of interventional orthopedics, not to be confused with surgical orthopedics, less invasive, new medical specialty. We deliver the PRP, or stem cells, by an injection. There are no scalpels or saws, and as such, there's a much lower risk compared to surgery. Regenexx started with the first stem cell treatment locale in 2005 in Broomfield, Colorado. We began treating as part of the Regenexx network in 2012. We were the 6th provider in the country. There are now over 75 providers. And what we're doing is we're harnessing the body's healing potential. Just like the Earth's energy reserves, we hold powerful healing factors in reserve in our platelet-rich plasma and our stem cells. And by concentrating them and focusing them in terms of treatment areas, we can successfully heal tissue, reduce pain, and improve function. Understand that we are FDA compliant, but when you, these are not embryonic tissues, which are controversial. These are your cells. Again, they are FDA compliant, and when concentrated and image guided, we effectively heal damaged tissue. How do stem cells work? They act as general contractors, conducting the repair of any condition in the musculoskeletal system. And they tell other cells what to do. They orchestrate the repair. When used in conjunction with PRP, the stem cells seem to work better and harder. And they can also turn into cells such as bone cells, cartilage cells, tendon cells, muscle cells. They are pluripotent cells, and they can do that. So really what matters in this arena, first, physician expertise matters. We've done over 3,000 stem cell procedures and 12,000 PRP treatment procedures since 2012. We have the largest, most vast experience, more than anybody else doing this in our area combined. We're physician experts holding board certification in physical medicine, rehabilitation, pain, and sports medicine, and we're certified through the Interventional Orthobiologic Foundation in all categories. We hold advanced certification. So you get a physician who's focused on your care, not a physician extender, nurse practitioner, PA, chiropractor, or naturopath. And diagnosis matters. In order to, you need a physician to make the correct diagnosis. If you don't make the correct diagnosis, you're going to treat the wrong area about a third of the time, and as such, the outcome's not going to be as good. Image guidance matters. We use ultrasound and fluoroscopy, which is an X-ray machine that tilts in space, to provide precisely guide these orthobiologic injections. We provide comprehensive treatment of joints, tendons, ligaments, and it is the most effective way to enhance healing, reduce pain, and restore function by treating a joint comprehensively, treating not just one site, but many sites under image guidance. The cell types matter. Mesenchymal stem cells are derived from bone marrow, as we do are FDA compliant. The FDA considers adipose or fat that's been washed with an enzyme to get the stem cells out illegal. They say you're making a drug. The FDA considers commercial products containing placenta, amniotic, cord blood, Wharton's jelly. These tissues have no stem cells in there. Considered illegal, and the FDA has come after folks who are providing these treatments. Dose matters. One size doesn't fit all. Specialized dosing for individualized treatment. We treat tendons, ligaments, joints. They all require specific types of PRP and different doses of PRP for optimum healing. We use a laboratory rather than a bedside centrifuge. Safety matters. Regenexx has the largest safety paper out with 2,500 patients. We find the treatments are extremely safe. The most common complication with pain at the injection site, typically 1 to 3 days of partial downtime, very low risk of complication. Part of the reason for that is the image guidance. Thus far, to date, we have a 0 infection rate. Research matters. Regenexx has completed 40% of the world's research on stem cells. We have a registry that contains 35,000 patients. You can go on the website, see how a patient does by their injured, painful body part. And you can also see how we do treating those injured, painful body parts. With science and consistency, we show what works, and we strive to make it work better through research. So there are things that don't matter. Weight does not seem to be a factor, particularly in knee osteoarthritis. We have many patients who we treat that are obese, and they seem to do very well. So they are good candidates for the Regenexx procedure when they've been excluded for surgery. Age doesn't matter. We've treated people 99 years of age. We see that stem cells work just fine in the elderly. Their stem cells, we have less cells as we age, but more than enough cells to treat one large joint. The degree of osteoarthritis doesn't matter. People come to us saying that they have bone-on-bone osteoarthritis of their shoulders, hips, knees. 87% of the people who were told that they were a candidate for knee joint replacement when they underwent the Regenexx procedure, they didn't undergo total knee arthroplasty. And these stem cells can work for many years. We think now 10 to 15 years may be the potential outcome for the treatment that we're now doing. So bone on bone does not seem to matter. Which one is right for you? We use PRP for smaller joints, less severe injury, less severe ligamentous tendon injury and spine, bone marrow concentrate, stem cells, larger joints, more damage, greater severity, and we can treat lesions within the bone, whether they're acute fractures or dead bone, with your stem cells. So we're trying to let the body heal itself. We know that surgical orthopedics won't be the dominant form of care in the 21st century. If you think of meniscal surgeries, 95% of the meniscal surgeries remove the needed meniscal space or a part of it. It creates stress risers in the knee, leading to premature arthritis and bone-on-bone osteoarthritis, whereas when you put an orthobiologic in, you repair that tissue, and the biomechanics of the knee or whatever joint stay the same. So with the treatment, this is a fellow who's had 2 anterior cruciate ligament repairs, as you can see, Band-Aids, not big scars, big bandages, are all that's necessary. Less downtime, shorter rehab, less drugs. You're back to work in days, not weeks, and you remain awake. So markedly less downtime. There are people who don't do well. Not everybody is a candidate. And I put the leaning tower of Pisa on the left to demonstrate what we see in the knee on the right-hand side. This is a person who's knock-kneed. And at some point, after about 10 degrees, you've gone too far. And regardless of what we do, you're going to continue to topple. We see people who have metabolic syndromes. They're very sick with lots of medical conditions, and they don't do very well. Recent cancers, metastatic cancers, we can treat those people with platelet-rich plasma, but not stem cells. If you can't get off your blood thinner medication or your steroids, you're not a good candidate. And those people who have arthritis all over their body are not as good a candidate as those who don't. So there are 3 parts to the stem cell procedure. First part is tilling the soil. We stimulate the inflammation to rally your body's immune response in the area. We treat your ligaments to strengthen and tighten them as well. This is like electrostatic painting. We're getting the surface ready to go. There is a heightened immune response that prepares the site to take full advantage of the stem cell injection. It's usually done under ultrasound guidance, takes a half an hour, and virtually everybody who undergoes it leaves feeling better than when they came in. 2 to 4 days later is the main treatment. We plant the stem cell seeds after obtaining bone marrow aspiration, and we implant them with both ultrasound and fluoroscopic guidance in the site of injury and damage. The bone marrow aspiration is something that is mildly uncomfortable. We have a lab on site. It takes about 2 hours to get the mesenchymal stem cells and other cells that are living and helpful in this process extracted so that we can re-inject later that day. And this is just an example of someone who is undergoing the bone marrow aspirate. I thought it was nice to see. You can see the ultrasound screen in front. This is Dr. Adelsheimer's patient, and he's using ultrasound to guide a bone marrow drill bit, and then providing a slight drilling. As you can see, the patient didn't flinch during the process, and we prepare and extract the marrow. And as you can see, it's pretty painless way to get your bone marrow, and that's where we do it, and most of the time how we do it as well. The third part is fertilizing the stem cell seeds. We draw your blood. This treatment occurs 2 to 4 days after we've planted the stem cells. We get platelet-rich plasma from your arm, blood draw. We take it to our lab, get the PRP concentrated, and re-inject it to get your stem cells to a higher level of function. This is Julie. She was a person who had lupus, who developed a big hole in her knee, a dead bone. She was treated with her stem cells, and as you can see, the size of the dead bone reduced, and after 3 years, she got her life back. She was able to get rid of her crutches, started enjoying her life once again, and get back to work, improving her fitness and improving her relationships and getting off the drugs that she had been taking. So there's really the next step to doing this, no referral necessary. Get your imaging, bring it your MRI or your X-ray if you have both. Bring whatever you have, call the Regenexx liaison. You go to an appointment or a telemedicine appointment. We can prescribe your imaging if you don't have it before the visit. And if you're a candidate, and most people are candidates, get treatment. You can rehab at home or short duration physical therapy and get back to the life that you want to lead. So make an appointment. We're all local doctors. We're Pittsburghers. We are specialists in this area. We have advanced training, and we're going to use image guidance to make sure that you get a great result. So you'll come in for an exam. You spend almost an hour or an hour with the doctor. There's no other arena where that occurs. We're going to get a history, do a physical, review your diagnostic studies, perform an ultrasound examination if it's a peripheral joint, and you'll get your questions answered. One of the things that's important that we think about is the interconnectedness of your joints, ligaments, tendons, and how your nervous system affects those things. Sometimes we want to treat your nervous system, treating a nerve coming from your neck or your back to help your joint progress better than it would have had we not done that. So get treatment. Don't waste time. You're going to have little to no rehab, minimal pain meds. We will give you some pain meds after your treatment for a day or so. You're not going to miss work. You'll be able to get back to work and to the life that you enjoy much sooner than if you would have undergone surgery. So don't delay. You can avoid the surgery backlog, avoid the worsening of your condition. There are occasions when people have waited so long that they've become a non-candidate when they initially were candidates to undergo this treatment. We want you to get fit, lose the weight that you've gained, improve the quality of time with your loved ones. And remember, you're not getting any younger, so don't put this off. The insurance most often covers the consultation, the follow-ups, the diagnostic studies, the bracing, and the therapy. It doesn't cover the regenerative treatments that we provide, the prolotherapy, that was tilling the soil, PRP, platelet lysate, and stem cells. Remember that with copays and deductibles and lost productivity, you're most likely paying more for traditional orthopedic surgery than you would be with regenerative treatment. And we customize everybody's treatment plan for their individual benefit. This is not one size fits all. Contact Sarah Matthey. She is the Regenexx liaison who works for Regenexx and will schedule patients for the doctors. And here's the phone number, 412-963-6480. So avoid surgery, reduce downtime, and get your life back. Remember, you're able to get what will be the standard in the future for treatment of orthopedic injuries now. So get back to work, get back to your life, and have no complications with non-surgical orthobiologic treatment using your stem cells and platelet-rich plasma. So that's it. I see I have a couple questions, so I'll try to answer them now. So the first question, what are the stem cells from to regrow knee cartilage if you have arthritis? So if you can hear me, we extract the stem cells from the bone marrow, and they will grow a little bit of cartilage. But there are two things, particularly in knee treatment or anybody with severe osteoarthritis. They change the internal environment of the knee from breaking down to rebuilding. And also, we've been putting cells into the bone above and below the joint in the knee. We've been doing this in shoulders and hips where there's advanced arthritis. And what it does, it fortifies the bone from the inside out. And that seems to make a bigger difference even than putting cells on the articular surface of the joint. So the next question, are the fees for knee regeneration per knee or what? Yes, the fees are per knee. And if you're interested, come in for a consult. We can talk about that. There are occasions when we can do both knees at once, particularly if your arthritis is beneath your kneecap and your medial joint and your lateral joint are unaffected. But most times we're doing one joint at a time because we don't want to rob Paul to pay Peter, and we want to use the most stem cells available to us to do the repair. Next question, using PRP for the spine, when you say low risk of complications, what does that mean and what types of complications? I would say that the chances of a complication are less than 0.1%, so less than 1 in 1,000, probably more likely 1 in 5,000. So there is a risk whenever you do an epidural injection with platelet lysate or with steroid, and you're using a central approach, which is called an interlaminar approach, that you can go too deep and puncture the sac that surrounds your cerebrospinal fluid. It's not a dangerous thing, but the fluid can leak, leading to a spinal headache. And that happens about 1 in 5,000 cases. Otherwise, this is essentially risk-free. Next question. I have 2 friends who would be interested in this procedure as well as myself. Can you send me a recording link of the webinar to share with them? Yes, the webinar is recorded. It should be transferred to the website. I don't know whether it's immediate or whether it takes a day or so to do so, but it will be on the Regenexx Pittsburgh website. Next question. How long are you usually off work with the hip stem cell treatment? So hips, depending upon what we're doing, whether we're treating osteoarthritis or tears of the labrum, which is the cup that holds your the head of your femur, the leg bone, in place. Usually people are off work for less than a week. Now, having said that, hip joints are the only joint in the body that doesn't do as well as the rest of the areas of the body that we treat. So if you are over 60 years of age and you have limited hip mobility, we're generally going to recommend a hip replacement for you because your chances of doing well with stem cells are poor. There are people who don't care that they want to take that option, and if we treat you, it's likely that you're going to get some pain relief, but not the kind of relief that you would get with a hip replacement. If you're under 60 and your range of motion is good, my sense is that you're going to be off work for less than a week unless you're a heavy laborer, in which case you may be off 2 to 4 weeks. Next question. I wish I would have done this for my first knee. I had a total knee replacement. It was very difficult to recover from. So we see this time and time again, that people have had a total knee replacement and undergo the regenerative treatment and do much better. Your orthopedic surgeons are not going to talk about stem cell treatment. They don't know the outcome from the stem cell treatment that we do, but it makes a big difference. We have lots of satisfied patients who have had a poor outcome or just don't want to undergo the prolonged rehabilitation from knee joint replacement. So I'm sorry that you didn't know this a while ago. So next question, can taking stem cells from your body cause cancer in the cells later? The answer to that is no. The caveat, and again, no cancer has been proven from this, is bone marrow derived cancers such as leukemias and lymphomas that are active. We will not take bone marrow from you, though there's never been a case of stem cell causing cancer in another area. It's just the practice that we don't do. We can treat you with platelet-rich plasma. In cancers where you're in remission for several years, typically 2 years, in some prostate cancer, which is slow growing and requires no additional treatment other than prostatectomy, we can do stem cell treatment much sooner. In cultured stem cell treatment, which we don't do in the United States, but which we do in the Grand Cayman Islands, we will typically send a sample of your cells out for what's called karyotyping to look for any abnormal cells, because we don't want to grow abnormal cells in a laboratory. It may cause a problem. So, next question. I live in State College. Would I be able to drive back and forth for each of the steps in the process? The answer is yes, with the exception of planting the stem cell seeds. Typically, we like people to have accompaniment for that process, particularly if you're bone on bone, arthritis of the knee, shoulder, hip, where we're putting cells into the bone. We're typically providing you with some conscious sedation during that time period. So first treatment, yes. Third treatment, yes. The big treatment, maybe. Next question. If you need stem cells in the bone, when the doctor performs the surgery, do they make that choice when they get in the area? No. So the choice is made in advance. Again, if you're bone-on-bone osteoarthritis of the knee, we know that the outcomes are better when you put the cells into the bone in addition to on the joint surface. The literature that came out of France showing 10 to 15-year outcomes where they only put the cells into the bone shows that that works better than putting it on the articular surface and has a higher likelihood of preventing total joint replacement down the road. Again, we do both. As far as if you have a dead bone in an area, we're going to know that based upon your MRI scan, and we're going to plan for that, whether that be in your ankle, your shoulder, your knee, or your hip. We'll put cells into that dead bone area with the intent to lessen your pain and bring that area back to life. Next question. In the spine, do these types of treatments just speed up the recovery process, or do they go further? So the answer is yes, they go further. We help the tissue heal. We help prevent further arthritis. We increase the stability of the spine. In most treatments, we're treating ligaments, bone, ligaments, joints, nerves, muscles in a concerted, comprehensive effort to stabilize your spine posteriorly, and if need be, we'll go into your disc with the intent of healing your disc as well. Next question. If you are 50 and get the hip stem cell procedure, can it last 5, 10, or 15 years? And can PRP help labral tears? So the answer to the first question is before we were putting cells into bone, we were on average getting 5 to 6 years of benefit. The literature on putting cells, so we were putting it on the articular surface and we were getting 5 to 6 years of benefit on average, some longer, some slightly shorter. When we put the stem cells into bone, say you have severe arthritis with normal range of motion, you're 50 years of age, we believe, just like in the studies that have been done on these, that your outcome will last longer, but there hasn't been a research study done on that. But it makes sense. You're rebuilding the joint from the inside out, and the joint does break down prematurely when you have bone-on-bone arthritis. So second part of the question, can PRP heal labral tears? So the answer is yes, but the labral tears have to be relatively small, and the arthritis needs to be relatively mild to heal an isolated labral tear. Otherwise, we think stem cells are going to do a better job. Next question. Spinal headache is a risk, more for the epidurals, but not for treating spinal ligaments. The spinal headache is only a risk for doing a central epidural. Again, the likelihood of a spinal headache, which is treatable, is about 1 in 5,000 from a dural puncture. Treating spinal ligaments, the risk is extraordinarily low, with the exception of ligamentum flavum which is the deepest ligament in the spine surrounding the posterior aspect of the spinal canal, where if you treat that ligament, you're right up against the dura and potentially could go into the dura. I have never had that experience, but it would be a possibility. Next question. How long are you off work with a stem cell hip procedure? I tried to answer that question saying, it depends upon a number of things. What type of work you do. I mean, if you're a heavy laborer, you're going to be off for a couple of weeks. If you sit down at a desk job, you may not need to be off work at all. It also depends upon whether we're putting cells into your bone, in which case you may be off work longer as opposed to if we're putting it only on the articular surface. So rehab for stem cells of the hips. Typically for all of this, the rehab is 1 month. You can go longer if need be. If we're trying to get your range of motion back in your hip, then you may be involved in therapy for a longer period of time, but typically 1 month. Next question, do you have the capabilities to accomplish the MRI on the joint in-house, or the patients have to have them done prior to this? So the answer is no, you don't have to have it done prior to our seeing you. We can write a prescription to have it done if you have the capability of having an MRI prescribed by somebody else and can bring it. The pictures, we like to look at pictures and images and show you what you've got. That's a better way, but not necessary. We don't prescribe MRIs all the time, but sometimes it's necessary to have that diagnostic study done and available to us. The other thing is that we do not have an in-house MRI. So all of the MRIs are done outside our facility. Sometimes there's a considerable wait to get in. There is one self-pay facility in Pittsburgh that often can get you in within a day or so. Next question. Do you ever have to repeat the process? So that brings up a good point. There are some people, about 20 to 30% of patients have what's called a booster procedure to boost the function of the stem cells. And often that's done within 6 months to a year. And I've had 2 stem cell procedures now, one in my knee and ankle, and the other in my right shoulder. And in my knee, I get cranky when my function is below 90%. As you know, I'm an avid cyclist, so I don't like to miss any bicycling. So I will boost once every year or so. As far as repeating stem cell procedures, very occasionally we have repeated stem cell procedures for those people who are out many years. We now know, particularly in knees, that injecting into the bone is a better outcome than just on the articular surface. So for those people who have started to have symptoms again, most typically 5+ years out, we may offer a recommendation of a intraosseous in the bone stem cell procedure, along with an on the articular surface of the joint stem cell procedure simultaneously. But it's unlikely. We don't. So if you've not done well with the stem cell procedure, say you were 6 months out, we would recommend a PRP booster, but not a repeat stem cell procedure at that point in time. So it's a rarity. So hopefully, if anybody else has a question, I'm happy to answer it. I've answered all the questions that you've raised at this point in time. Remember that you can come in bringing the diagnostic studies that you have, undergo a consult which your insurance pays for, hear what we have to offer, and make a decision about whether that's something that you're interested in undergoing. But knowledge and making the right diagnosis is half the battle. Also understand that the hip bone, the knee bone, the ankle bone, the shoulder bone, elbow bone, et cetera, are all interconnected. And that there are what are called fascial planes that connect these areas. And also understand that, for instance, in the case of somebody who has an isolated Achilles tendonitis, or I should call it tendinopathy, that sometimes treating the spinal nerve involved fortifies that tendon much better. I recently treated my wife and treated her Achilles. She has a back problem. Her Achilles didn't get all better. And so the next time I treat her, I will treat 2 of her spinal nerves to give her the best possible outcome, in addition to going back and treating the Achilles. It's a rarity, but it makes sense to think of these things. And we always think of these things, whereas physician extenders, nurse practitioners, et cetera, don't think that way. We also always treat joints comprehensively, ligaments, tendons, joint capsules. So we're trying to maximize and fortify that joint the best way we can with image guidance to put the cells on the injured surface and make the joint as viable as possible. I hope I've answered your questions, and I appreciate your attending, and hopefully I'll see you soon. Thanks so much. Take care. Have a great day.